In this presentation, we will cover how to take vitals on your horse. Let's start with the heart rate. Normal heart rate for a horse is 35 to 45 beats per minute at rest. Abnormal would be anything over 80 beats per minute or under 20 beats per minute. To check the heart rate, you want to place a stethoscope on the left side of the horse's chest just below the elbow in the girth area. You will hear a lub-dub sound, which consists as one full heartbeat. Count the number of full beats for 15 seconds and then multiply this by 4 to calculate the heart rate beats per minute. If you do not have a stethoscope, you can take the pulse from the facial artery on the bottom of the horse's jaw in the shallow groove underneath the cheekbone on each side of the face. You can count each beat for 15 seconds and then multiply it by 4 to calculate the heart rate beats per minute.
Okay, taking the heart rate. The heart rate for the horse, anything normal, is the range between 35 and 45 beats per minute. And abnormal is anything over 80 or under 20. So how you're gonna take the heart rate is use your stethoscope. You can get these online or at any store, Walmart or Target or any place like that, Walgreens, CVS. They're widely available. Okay, and you take your stethoscope and you're just gonna listen right here. Can't talk with the same thing. Right behind their point of shoulder here, and you're gonna listen for a lub-dub. And it's actually 1 beat per lub-dub. So you're gonna count for 15 seconds. So it's gonna go lub-dub, that's 1. And then you're going to count for 15 seconds and then multiply that by 4. If you don't have a stethoscope, the other place that you can do is right here under the facial artery. And you just put your finger here and there's a pulse and you can count that as well. Or you can also do their digital pulse, which is right here. And you can count that as well.
Next, take the horse's respiration. Normal is 8 to 15 breaths per minute. To do this, stand next to the horse, next to their shoulder, face towards their rear, so that you can look at the rib cage and count the number of times it expands and retracts for 1 minute. Note that the horse's respiration rate can increase due to exercise, fever, pain, or hot and humid weather.
Checking your horse's respiration. So a normal range is anywhere from 8 to 15 breaths per minute. So what you want to do is just stand next to your horse and look straight down, and you can see their rib cage moving up and down. And all you want to do is count the number of times that they breathe. And you want to do this for 1 minute, and a normal range is 8 to 15 breaths per minute. You can also count the nostrils. You can just stand back and look at their nostrils breathing. So some of the things to be aware of is you want to make sure if they're under pain, stress, or duress, or any kind of hot, humid weather, pain, exercise, these all increase their normal breaths per minute, or could increase. So it might be a little off. So you want to make sure that your circumstances, you're also measuring that in with what's in a normal range.
Next, take the horse's temperature. A normal temperature for a horse is between 98.5 to 101 degrees Fahrenheit. Use a digital thermometer to take the horse's temperature rectally. Place some lubricating Vaseline or jelly on the tip of the thermometer before placing it into the horse's rectum. Once it is inserted well into the rectum, you want to wait for it to beep. We do not recommend using a mercury thermometer as it could break, which would be toxic for the horse and yourself if you touched it.
Okay, taking a horse's temperature. The normal range for a horse is 98.5 to 101. And one of the things you want to do is take your horse's temperature at a normal time where they're not stressed or under pain or duress. That way you'll know where your benchmark is and what your horse's temperature is normally. Just in case you take their temperature in a stressful situation, and if it's higher than the normal range, you'll know that you're actually normal for your horse. Some horses actually run hot. They can have a temperature of 101 normally. So a good measure is to know where your horse is normally. So I recommend using a digital thermometer. You can get these at any place. You can get them at Walmart or CVS, Walgreens, pretty much anywhere. And I don't recommend using the thermometers with the mercury, the glass thermometers that can break. So we all know horses are prone to injury, so we don't want to cause any further damage. And these are safe and they're actually faster. And if you use the glass thermometers and they break, the mercury is actually very toxic. So we don't want that going into the horse's system. Okay, so the first thing you're going to do is you're going to get your lubricating jelly, which is just regular petroleum jelly, again at any store. And you just put some right here on the end. And then you're going to safely walk around your horse. And if you prefer, you can use vet wrap to wrap the tail if you don't want to have the hair in the way. Or you can just simply use the tail just the way that it is. Okay, and then you just insert. Now you want to stand over to the side because if your horse is not used to this, they could kick. Okay, but you just insert the digital thermometer and push the button. You can hear the beep. And then you just wait. And then it takes about a minute and it'll beep. And she's normal.
Next, you can listen to your horse's gut sounds. Normal for a horse would be have an audible sound such as gurgling, bubbling, and rumbling when you listen to their gut. Abnormal is an absence of sounds, and this is a sign of colic. To listen to your horse's gut sounds, you want to stand next to your horse's shoulder, face towards their rear, and place your stethoscope firmly on the horse's stomach just beneath the last rib and listen for these bubbling and gurgling sounds. If you do not have a stethoscope, you can also just place your ear on the horse's, on this area of the horse's stomach to listen for these sounds as well.
Okay, listening for gut sounds. One of the things that you can do is take your stethoscope and you're going to be listening for any type of rumbling or gut sounds that are going on in their digestive system. If you aren't able to find any sounds, that could be a sign of colic. So this is one of the methods that you can do. Just take your stethoscope here and just listen. And you should hear gurgling or any kind of movement going on in there. Another thing, if you don't have your stethoscope, you can just simply listen with your ear. And I can hear all kinds of gurgling going on in there. So she's healthy.
There are a couple ways that you can check your horse's hydration. The first is to check the capillary refill time. To do this, you want to lift the horse's upper lip and press on the upper gum. The point of the pressure will become a lighter color. So if you press on that pink gum, it should turn to a light pink or white color from the pressure. And the amount of time that it takes for the color to return to the gum is the capillary refill time. This is the time it takes for those blood vessels to fill back up with blood. And this can determine your horse's hydration. If the horse takes about 2 seconds for this color to come back, that's considered hydrated. If it takes over 3 seconds, that can be considered dehydrated.
Another way to tell if your horse is hydrated is the capillary refill time. So a good way to do that is you just lift the upper lip here, and they usually have a pink color, and you want to push the gum, and it's going to turn more of a white color. You push, and it should return to the regular pink color within 2 seconds. Within 2 seconds is hydrated. 3 or more seconds, your horse is dehydrated.
The next way to check hydration of the horse is with a skin pinch test. To do this, you can pinch a small amount of skin near the shoulder on the horse. When you release the skin, the amount of time that it takes for the skin to snap back into place can determine your horse's hydration. If it snaps back immediately, that means the horse is hydrated. If it takes 2 to 4 seconds, that can mean moderately dehydrated. If it takes more than 4 seconds, that can mean that the horse is severely dehydrated.
The skin pinch test is to determine the hydration of the horse. So if you just simply take your fingers and pinch the skin here right near their shoulder, if it immediately releases, that means that they're hydrated. So So the release time is how well the horse is hydrated. 0 seconds is hydrated, 2 to 4 seconds is moderately hydrated, and if it takes 4 or more seconds to have the skin go back into place, that means they're severely dehydrated.
It's very important to know how to determine the weight of your horse. The weight can help you determine the proper amount of medications to administer to them, and it can also help you monitor any weight loss or gain that your horse may be experiencing. So there are weight tapes that you can use, which is a tape that you put around the horse's girth, and it will give you an approximate weight based on that measurement. But you can also do it without a tape. And to do this, you want to measure the horse's heart girth by putting the measuring tape across the highest part of the withers and wrapping it around while keeping the tape close behind the elbows. Measure the length, which is the point of the shoulder to the point of their butt. And then you want to multiply the heart girth by heart girth and then by length. And then you want to divide this number that you get by 330, or if you were trying to measure the weight of a foal, you would divide it by 305. And this number is going to equal the approximate weight of the horse.